name is Emma Jefferson. I'm here to present Poking the Cat, making insulin treatment for your cat easy. So how to watch this video. The presentation is again to give clients with a newly diagnosed diabetic cat a primer on giving insulin therapy. Each slide has recorded audio and transitions. Please sit back and enjoy. And I'll be assisted by my cats Hubert and Kieran. So what is feline diabetes? Essentially, it's when a cat is unable to regulate their blood sugar properly. How does it work? Part 1, feline diabetes. How does the body regulate blood sugar? Eating food causes blood sugar, or glucose, to rise. Insulin is released by the pancreas in response to rising blood sugar. Insulin enters the bloodstream and attaches to cells in the liver, muscle, and fat to signal them to absorb sugar. Sugar levels in the blood decrease, and the cells in the body are able to use sugar for various functions. So how does diabetes work? Type 2 diabetes is the most common type of diabetes in cats. It is caused by insulin resistance. My cat Hubert, for example, has type 2 diabetes. Insulin resistance is when the liver, muscle, and fat cells no longer properly respond to insulin. The result is that glucose, or sugar, does not leave the blood and causes high blood sugar, or hyperglycemia. This video shows where insulin attaches to receptors, but then the body does not respond to them, and so glucose does not enter the cell. Some of the consequences of hyperglycemia are peeing a lot. You might see your cat pee a lot because excess glucose in the blood is not properly reabsorbed by the kidney, so water follows and makes the urine very dilute, which can cause dehydration. If your cat is dehydrated, they'll drink a lot of water to make up for water loss in the urine. They also might have weight loss despite a good appetite. They also have lethargy and tiredness. Some of the complications of diabetes in cats include sugar in the urine, which makes them more likely to get bacterial infections and urinary stones. They can also have damage to the kidneys, nerves, and retina, and muscle weakness. Some of the more severe complications of diabetes that are somewhat outside the scope of this presentation include hepatic lipidosis, which is when a cat who is not eating for multiple days increases the mobilization of fat for energy, which overwhelms the ability of their liver to process fat and can lead to severe liver damage. This is a medical emergency. Additionally, diabetic ketoacidosis, when the body does not have enough insulin to absorb sugar from the blood, causes the cat to produce ketones to meet energy needs instead. Ketones cause the blood to become more acidic, which upsets many processes in the body. This is also a medical emergency and can lead to a cat becoming very sick and being hospitalized. You should always talk to your veterinarian if you have any concerns about your diabetic cat, and I've included some resources on the sources page to help you learn more about both of these conditions. So why do we give insulin in the first place? To prevent all of the bad things caused by high blood sugar. Because the patient does not respond to the amount of insulin their own body is making, we have to give more. So you can go from a sad, hospitalized cat to a happy cat. Part 2, insulin therapy. First, let's look at the anatomy of a syringe. You have the cap, needle, barrel, and plunger. When you look at the needle, the tip of the needle, you can see the bevel, which is the pointy end, which is the cutting part of the needle. How to read an insulin syringe. You always read from the top of the plunger. Kieran says make sure you read carefully. How to read an insulin syringe. Here's an example. This little top line here is 0 units. So what about one line under that B? Because you read from the top down. That would be 1 unit. What about this little line in the middle? Think about what that would be. You guessed it, 12.5 units. How to be safe with insulin syringes. Be careful when you're handling your needle. The needle bends very easily and is extremely sharp. Avoid replacing the needle cap and use caution if forced to do so to avoid injury to yourself. Be careful when disposing of your needle. Place it in a dedicated sharps container. That can look like this or this. Maintain sterility. If you drop an open needle or poke something that's not your cat, get a new needle. Finally, for disposing used needles, talk to your veterinarian and pharmacy about local disposal regulations because they differ quite a bit. For insulin treatment, there are many different types of insulin, so refer to instructions from your veterinarian on how to store and care for the insulin your cat is prescribed. Give insulin at the time of day indicated by your veterinarian, and make sure you're using the correct syringe for the insulin your cat is prescribed, U100 or U40. Dispose of expired insulin and get a fresh bottle for your cat. How to prepare an insulin injection. I recommend you watch this video, but I'll go through the steps in order. Prepare insulin according to your veterinarian's instructions. You may have to remove the bottle from the fridge and roll or shake the bottle to mix the insulin. Remove the cap from the syringe, invert the insulin bottle, and pierce the septum of the bottle with the needle. Draw back more insulin than you need. Push insulin back into the bottle until you're at the amount prescribed, and try to remove as many bubbles from the syringe as you can. Remove the needle from the bottle and replace the cap. Return the insulin bottle to the fridge if necessary. How to give insulin injections. Watch this video for more information. Give insulin after your cat has eaten a meal. Gently pinch the skin along the back of the neck to form a tent. With the bevel of the needle up, pierce the base of the tented skin. Once the needle is inserted into the skin, push down the plunger to give the insulin. Remove the needle and let go of the skin. And rub the injection site to check for wetness. If the fur is wet at the injection site, the insulin was not successfully given. Good job, you gave insulin. Troubleshooting insulin issues. So what if things don't go the way I planned? If you don't know what to do, call your veterinarian. But here's some other common issues as well. If your insulin syringe is no longer sterile, if you dropped it on the ground, poked yourself by accident, get a new syringe and put on a Band-Aid. What if you check the injection site after giving insulin and your cat's fur is wet? That means your cat didn't get all of their insulin. So monitor blood sugar and behavior, but do not give more insulin unless it's recommended by your veterinarian. If you accidentally gave your cat too much insulin, call your veterinarian immediately. Give honey or sugar water on their gums and monitor them for signs of low blood sugar or hypoglycemia. What if your cat didn't eat, vomited after eating, or was acting sick or stumbling? Call your veterinarian immediately for advice. Some of the dangers of low blood sugar include, low blood sugar is called hypoglycemia, and your body needs sugar to survive. If you don't have enough glucose in your body, it can lead to death. Some signs of low blood sugar include weakness or tiredness, vomiting, stumbling, seizures, blindness, and coma and death. The important thing to remember is that insulin treats diabetes, but only if it's used properly. If you lower blood sugar too much, you become very dangerous. So, for example, if your cat didn't eat or if you gave too high of a dose of insulin. How to test blood sugar. If you're worried about your cat's blood sugar, if you think it might be too high or too low, or you're not sure, you can test it yourself with an AlphaTrack blood glucose monitoring system. Looks like this. It involves taking a drop of blood and placing it into a strip that is placed in the blood glucose meter. You can draw blood from the ear or the paw pad. Here's a video explaining how to do that. And here's a picture of the process as well. It's somewhat outside the scope of this presentation, so if you have any questions about it, I recommend asking your veterinarian. Part 3 is cat-friendly insulin treatment. How will your cat respond to insulin injections? Most cats tolerate daily insulin injections very well, actually. It's because insulin needles for cats are very small and very sharp, so they pierce skin with minimal pain. Insulin itself is not painful when injected and is given under the skin in areas where it cannot damage any parts of the body. But what if your cat doesn't tolerate insulin injections? So environmental considerations you could look at are ensure your cat is in a comfortable and calm environment when you give insulin injections. Find a place where your cat is comfortable, a favorite bed, cat tree, or even your lap. And keep people and pets that stress your cat out of the room. And try to decrease your own stress. If you make a big deal out of giving the injection, your cat might make a big deal out of getting it. Something else you can do is distract your cat. Many cats won't even notice when they're given an insulin injection if they're distracted when it's going on. Some great options are low-carb canned food or treats, such as churros, petting or brushing your cat, and catnip or toys. Just make sure they don't move around too much when you're giving the injection. You can also use some cat-friendly handling techniques if your cat isn't cooperating. Some cats might need restraint, but try to restrain them as little as possible because some cats become stressed by excessive restraint. You can have a helper assist you if necessary, and use towel or blankets to wrap around them, but make sure you can still access the spot where you want to give the injection. You can also spray synthetic feline pheromones, such as Feline, on the towel or blanket to help make them feel more calm. And monitoring your cat's behavior around the injection. It helps keep you and your cat safe to see how they're reacting to the injections. A cat that is not cooperating for their injections might be scared, frustrated, or in pain. Cats might escalate their behavior by scratching, biting, or trying to escape if their fear is not recognized and the appropriate steps taken to reduce it. If your cat becomes too stressed, you should take a break and try again with a distraction or cat-friendly handling approach. Hubert says to take a break and call your veterinarian if you need help thinking of things to make it work. So reading feline body language. Look, you can look for signs of fear, anxiety, frustration, and pain in your cat. Here's an example of different body systems and the signs they show. The eyes would be wide with pupils dilated. The ears might be turned backward. The whiskers might be turned backward. The cat's posture might be hunched, leaning away from you with their tail tucked, or standing erect with their rear end high in the air, approaching you. For behavior, some of them might hunch and freeze. Some may try to actively get away from you. Some may try to swat or bite. Some sounds you might hear are hissing, growling, and their fur might be standing on end. So here's some examples of feline body language. So these cats on the left, I'd say the one on the bottom is probably not stressed. The one above it might be mildly stressed. The tail's tucked a little bit. The eyes are kind of large. The cats in the middle, you can see very hunched, maybe trying to get away from you, eyes very dilated, ears back. They're moderately fearful. And the cats on the right, the one is standing up very straight with the ears forward, approaching you, but not in a friendly way. And the other one is swatting, looking very, very unhappy. So that would be a severely stressed cat. If you notice your cat's fear escalating, stop trying to give the insulin, take a little break, and then try a new approach. So I hope you've learned a lot from this presentation today. I know a diabetes diagnosis for your cat can be really scary, but I hope with the things you've learned that you feel more comfortable about giving insulin and working with your cat. So thank you.